one of the places that partnerships is so important is when we think about the social determinants that impact many of our patients. And that can be very overwhelming to us as providers. When we're working with patients who struggle with food or with housing or with transportation, oftentimes our experience of that is that it can feel like some of the most challenging patients, not because the people themselves are difficult, but that we feel like we can't meet their needs. So in order to be able to better meet their needs, we have to partner with others who can better address those needs. But how do we go about that? It's one thing to say it, and it's another thing to do it. And I think that historically, we would have approached that mostly from the perspective of a referral. Let's find out what food banks are available and write down that phone number and offer it as a referral to the patient. And what we know is that really isn't particularly effective. What I would recommend is first prioritize, pick one area that you think is relevant to many patients in your practice, and then find a resource. So pick one area, find a resource, and then reach out to them and develop a relationship. Like, this partnership is only going to work once you know each other. So make a phone call, connect with a person, go visit their site, have them come visit your site, and approach it from the perspective of how can we be the solution to each other's problems. Oftentimes, community services depend on external funding, which sometimes is based on the number of clients they serve. If we can bring them more clients, that can sometimes make them more sustainable. So we can help them solve their challenge even as they're helping us better serve our patients. So one example I heard about was a hospital with an outpatient clinic, and many of the patients that they were serving, both in their clinic and in their ER, really had issues around food availability. And so they specifically wanted to find ways to have access to healthier foods, fresh fruits and vegetables and such. There was also a local community group that was trying to work on bringing farm to table types of ideas and bringing more local growers and having places where they can distribute their fresh fruits and vegetables. And so they ended up partnering with this community group, which is actively trying to figure out where they were going to have their farmers market. They ended up offering to have the farmers market in the parking lot of the health system, of the hospital, community, and clinic. And by having it right there, as the patients left the clinic, there was available food to them. And eventually they continued to grow that partnership and find more and more ways to both serve the patients and the communities as well as their local growers.